Hey, thanks, Suzanne. Look, welcome everyone, and welcome again to the VICTAS Community Transport Association's weekly update, all revolving around COVID-19. Today we are very fortunate to have two great speakers, but first I'd like to introduce myself. So I'm Lyndon Stevenson. I'm the chair of the VICTAS Community Transport Association peak body, the chair of the national peak body, Australian Community Transport Association, and the CEO of a service provider in Tasmania called CTST. So again, welcome everyone. Like I said, we have two great speakers. We have Madeline Severini from Madeline Severini from Community Transport Team Leader at St John Ambulance Victoria, and it's great to have Madeline here today. We also have Adjunct Associate Professor Alan Eade, who's the Chief Paramedic Officer, Safer Care Victorian Government. So again, the speakers have been selected based on members' inquiry in terms of what members are wishing to get out of these sessions. So we've got, again, two great speakers. Kicking off now at 10:30, we'll finish at 11:30, so we've got plenty of time at the end for questions. So without any further ado, I would like to welcome Madeline. Over to you.
Thanks, Lyndon, and thanks everyone for having me here today. I'm just going to share my screen for you all, if you bear with me a sec. I'm just checking that everyone can see that now. Yep, beautiful. So thank you so much for having me here today, guys. My name's Maddie, as everyone affectionately calls me, Severini at St John Ambulance Victoria, and I'm the Community Transport Team Leader. Today I'm going to talk to you about St John's response to COVID-19, but before I begin, I would like to acknowledge the traditional custodians of the land of which we all meet today, for me being the Boonwurrung people of the Kulin Nation, and pay my respects to elders past, present and emerging. Okay. So St John Ambulance Victoria is a not-for-profit organisation and a charity that has been operating in the Victorian community for over 135 years, and our mission is simple: for the service of humanity. We exist to help those who are in sickness, distress, suffering or danger. Now, there are many facets of our organisation that are benefiting the Victorian community, such as our Transport Services Department, our products and kit servicing, first aid training, event health services, and various community programs as well. We have 544 paid staff members, 2,082 adult volunteers, and 490 youth volunteers across 59 facilities in Victoria. Now, you may be surprised to discover that St John does not receive any recurrent funding from the government. Through our commercial operations, our fundraising and donations, we're able to operate various programs to support the community. Some of the ways that we've given back to the community, as you can see here, is through our First Aid in Schools program, a community transport program, providing first aid at various events around the state, and also our CPR lab. Now, I'm sure, as everyone has been experiencing, we've had a significant decline in almost all areas of our organisation, which has meant that we've had to make some pretty quick decisions on how we were going to operate our business moving forward, which would be financially viable, safe for our staff, and as well as remaining true to our organisational values. From that second week of March, which almost feels like a lifetime ago now, St John made the decision to stand down the majority of staff members and volunteers, either partially or fully, and anyone that was able to work from home was encouraged to do so as well. For staff that were still fully or partially operating, it was truly amazing to see the hard work and the innovation that went into strengthening our processes and diversifying our operations. For community transport, just to give you a bit of a background on our service, when launching our service in 2017, there was much debate as to which umbrella the service would fall under, as our community programs, our transport services and volunteer programs all fall within different departments. So the decision was made to place community transport under the umbrella of Event Health Services, being that that was the department that manages our volunteer programs. So prior to COVID, the various administrative tasks for community transport laid within our customer service team, our volunteer resourcing team, with myself overseeing those functions, as well as driving, pardon the pun, the growth of that service as well. With bookings dropping by 50% during COVID, the first major change we made back in March was to consolidate all of the administrative functions into the one role and have that role working remotely. For our Event Health Services department, we were one of the hardest hit during COVID with the government regulations around public gatherings, which led to pretty much all events being cancelled and our volunteer divisions temporarily shutting down. This had left us with 2,000 volunteers in limbo, waiting to help their community, particularly as it was a time of crisis. What we did next was move our community transport induction online to fast track our first aid volunteers to becoming community transport drivers. And due to the amazing dedication and passion of our volunteers, we've moved to purely sourcing our drivers from our volunteer pool rather than having to fall back on our paid resourcing to fill any gaps. Other things we implemented in our community transport space are extra PPE, hand sanitizer, and disinfectant wipes in all of our vehicles. Also, contactless collection of vehicles and restocking of vehicles. Our volunteer drivers are disinfecting all commonly used areas of the vehicle at the start and end of their shift, and also between customers. We're limiting the number of passengers per journey and seating customers in the back where possible. Screening customers the morning of their bookings to ensure that they haven't come down with any cold or flu symptoms prior to travel, or been in contact with any suspected or confirmed cases of COVID-19, and if so, having to refuse that transport. We also have a clinical duty officer rostered 24 hours a day, which is staffed by our volunteer health professionals. And they're there for any advice for us or our volunteers, anything related to COVID-19. And lastly, temperature checking all of our drivers before the commencement of their shift. Our volunteer development managers have also worked very hard on ideas to keep our 2,500 volunteers engaged during this time. We've been sending out newsletters on a fortnightly basis to all of our volunteers, keeping them informed with what's happening around our organisation, and also including things like gardening tips or cooking tips to help with the boredom of isolation. On our volunteer Facebook page, we have been connecting with volunteers through photo sharing, things like movie suggestions, and we've also encouraged our volunteer divisions to continue with their divisional meetings, but on a virtual platform. Only in the last sort of couple of weeks, we've started to see things pick up a little bit more, which has been fantastic to see. And in our event health services space, we are getting some events come through, however, still at a reduced crowd capacity, which has meant that our deployment requirements are still quite significantly lower than pre-COVID. For our non-emergency patient transport department, we've adapted processes to include COVID-19 transport. This means transporting suspected or confirmed cases of COVID-19, and these patients generally require ongoing monitoring or care during transport, and it's generally between hospitals or between hospital and home and vice versa. Transports are generally in stretcher vehicles, and staff must wear masks, goggles and gowns, and patients are given masks as well, and also asked to undertake hand hygiene. Vehicles are required to be decontaminated after the use and correct disposal of the PPE as well. I'll just go to the next slide there. In addition to this transport service, we have also been contracted by the DHHS to provide a new transport service purely for COVID-19. So with the help of our volunteer emergency deployment team, we've set up a service for the vulnerable members of the community to be transported to COVID-19 testing stations and clinics all throughout the state. With the success of this service, this was later adapted to include transportation of suspected and confirmed cases between quarantine hotels and from hotel to home or vice versa. Infection control procedures were set up by our clinical governance team and were signed off by DHHS. For this transport, there is no level of monitoring during transportation and no physical contact between drivers or passengers. Drivers and passengers are both wearing face masks and undertake in-hand hygiene, and all passengers are to be seated in the back of the vehicle. We take bookings from 8 a.m. to 8 p.m, 7 days a week, with a minimum turnaround time of 90 minutes from the time of booking. Bookings come through mainly from DHHS directly or Ambulance Victoria. However, testing stations, GPs and various other facilities are able to book on behalf of the passenger, just not the passenger personally. This service is kept very separate from our community transport service to ensure the safety of our current customer base in community transport. And we have specific vehicles that are used only for this transport service, and the volunteer base can only choose to drive for one or the other. So yeah, keeping that very separate. Since launching this service back in mid-May, we've now transported around 300 passengers, some being as far out as Mildura, Sale and Warrnambool. It's been very successful. It's great to see. In our commercial training space, we saw all of our venues shut down in March. During the shutdown period, we did move some of our commercial classes to an online model. This included our mental health first aid, Cert 3 in a non-emergency patient transport, our TAE and various other non-accredited courses. Since June 1st, we're very glad to say that we have now reopened 6 of our 8 training venues, with our remaining 2 venues to be reopened at the beginning of July. We are also still continuing to do some of our virtual training where possible, and we've made a few other changes in that space, which includes cutting our classroom capacity to 50% to abide by social distancing rules in the class. We've moved to a contactless class where participants are now demonstrating practicals on themselves or on the mannequins rather than on each other. We've set up the temperature screening stations at all of our venues, as well as distributed extra hand sanitizer, disinfectant wipes and PPE. And we've also strengthened our infection control processes to include COVID-19 and ensuring that each participant has their own equipment rather than having to share with the class. For our First Aid in Schools program, with primary schools limiting visitors to the school ground, we've now launched a virtual First Aid in Schools program. So our schools can log in via Zoom, where the children engage in various first aid related games and scenarios, and so they can continue to learn those vital skills that could one day save a life. We're now offering temperature screening for businesses across Melbourne. This includes delivering services to several banks, schools, as well as Melbourne Olympic Park. Our staff set up temperature testing stations at the entrance of the buildings for anyone entering or exiting the building. The feedback from this delivery has been exceptional, and particularly for our staff, it's been a great opportunity to be gainfully employed rather than being stood down during this time. We have expanded and diversified our product offering and are now sourcing local manufacturers and supply chains that are less likely to experience interruption. In addition to our first aid products and equipment, we are now selling temperature screening kits, various types of PPE through our contracted retailers, and as well as directly to businesses and the public. This is actually an area of our organisation that has increased significantly during COVID-19. And for anyone out there, if you wish to learn some more and see what we have to offer, you can find some information on our website, stjohnvic.com.au/products, or give a call to our friendly customer service team. In our kit servicing space, after initially standing down the majority of our kit servicing team, they're now back up and running, and bookings are coming through thick and fast. This is due to businesses starting to reopen again and are catching up with the backlog of expired or missing first aid products from their kits. We're currently in the process of also deploying some of our event health services salaried medics to assist the kit servicing department during the busy time, which is also helping to give out some extra shifts to those as well. Lastly, just a couple of other things that's happening around the organisation. Staff members across the building, across the business, are starting to be called back for additional hours, although staff that are working from home are still encouraged to do so until further notice. Any staff, volunteers, participants or contractors coming into St John facilities or performing St John duties must complete a health and temperature check before their shift. We've placed signage around all of our buildings as reminders for hand hygiene and social distancing. Disinfectant wipes and sprays and hand sanitizer are located around all of our buildings now as well. Extra PPE, hand sanitizer and various cleaning materials are placed in each and every one of our St John vehicles. We also have a requirement to disinfect our equipment and desks in the office, and we're limiting hot desks as well. Also coming into the cold and flu season, any person that comes down with any COVID-19 symptoms are considered positive until proven otherwise. So this means that anyone with any symptoms or living with someone who presents with symptoms are required to get tested and stay at home until well enough to return to work. And for staff still working in the office, they are required to bring their own kitchen utensils for meals and refreshments. All right, so that's me. There's so much happening around our organisation at the moment, and so much still to plan for now that we're sort of moving into a recovery period. But one thing for sure has been it's been fantastic to see everyone really working together and supporting each other through these uncertain times. And on another note, attending these sessions fortnightly has been really helpful for me. So I just wanted to thank all the previous speakers and any future speakers on sharing your organisation's stories. And a big thank you to Suzanne as well for making this all happen. Thanks very much.
Thank you. Thanks, Maddie. That was great. And I think it was great to hear not only from a community transport perspective, but what St John is doing more broadly. And they obviously do a great job in the community right across the country in particular, but in Victoria. So I think to hear what you guys are doing with the community transport, but also across the suite of services was really good to hear. So thanks for sharing that. Your journey so far, and I also agree that we've been quite fortunate, all the speakers we've had, so that's been fantastic. And I think it's quite interesting. I should have made the point probably earlier that we are seeing two situations emerge with what's happening in Victoria and what's happening in Tasmania. We've got well over 40 odd days now in Tasmania without a case, and we've got some obviously some challenges in Victoria. So I think this community issue is starting to play out slightly different now as we go forward. So that's going to be interesting to watch too. So again, thanks, Maddie. I'd like to now welcome Alan Eade, who's going to talk to the group about, I guess, what is happening from a Victorian government perspective. So welcome, Alan.
Thanks very much, Lyndon. And I'd like to join Maddie in acknowledging the traditional owners of the lands upon which we're all sitting, wherever that may be across the wide land. The internet takes us to all kinds of different places. So pay my respects to their elders past and present, and any elders who might be watching this in the future or online with us today. I'd like to say a big thank you first up to the entire sector. The work that the transport sector has had to do in what is difficult circumstances for all of us has been phenomenal. The vast majority of providers have worked out how to deliver a service during a pandemic, using personal protective equipment in many cases, changing their business models almost overnight to allow that to occur. And it's been a brilliant response to ensure that the community can still receive the ability to mobilise. And without that, the isolation that is being acutely felt across the system, across the community would be even worse. And so from me, on behalf of the government, I'm sure they don't mind me saying so, thank you for everything that the sector has been able to do to support our community. You mentioned the differences between Tasmania and Victoria, and stark reality, as you've highlighted. Today, for anybody watching in the future, is the 25th of June, and at 8 o'clock this morning, we saw a rise again. That's our seventh straight day of double-digit rises. So 33 new cases today for Victoria. 9 are related to outbreaks, 7 related to quarantine, and 6 from routine testing. The other 11 are still being investigated. And so whilst we haven't got a second peak, we are certainly at risk of seeing that, and we have a number of small areas or outbreak at the present moment that are being managed. In context, just for Victoria, that's we've had a total of 1,917 cases, of which 1,732 have recovered. So that means that there's 185 active cases across the Victorian community at this point in time. So the numbers still, even though we're seeing double-digit increases over the last few days, the numbers are still small of people who are in community who are actually carrying the corona, who are infectious with the coronavirus. The transportation, or the fact that we're receiving large numbers of international travellers into our jurisdiction is a source and will be a constant source of potential risk, and that's mitigated largely by our quarantine process. That's a process which is going to have to run for many months. This isn't something which will turn off shortly. And because we're going to have people in quarantine for a considerable period of time, there's going to be a requirement for a dedicated mechanism to move quarantined visitors into the state, or even residents who are returning to the state, to medical and healthcare appointments, or between quarantine facilities, and eventually from quarantine to their home once that's able to occur. So there will be an ongoing requirement for a dedicated quarantine transfer mechanism, which is what Maddie was alluding to and articulated far better than I have. The international travel, if you're wondering when you can next do your holidays, there may be a bubble that allows some local international travel, so maybe an Australia-New Zealand bubble or similar, but the best advice from the Commonwealth to this point is that international travel won't be open really until 2021. So I'm sorry if you were holding out for a trip, and so if you do happen to go overseas, certainly probably through until the end of the year, at least, when you return, you not only whatever country are you flying into, there may be some limitations on you, and you may have to quarantine at that end. You will definitely have to quarantine on return. So factoring that time frame into any plan to travel will be important. Maddie mentioned some of the things that we can do to keep people safe, and physical distancing and basic hygiene. I can't overestimate the impact that they have. If we can continue to be as physically separated as possible and be good, just generally good people, good hand hygiene, good cleaning of the spaces around us, then the risk for each of us goes down exponentially. And it's something really easy for all of us to do. If you're offering a transport service and you're concerned about whether or not you might be taking home a potential exposure, whilst the numbers of corona cases in the community are low, we are moving into the influenza season. And so there is a risk that you will take a virus home. It's probably not going to be COVID, but there are ways to mitigate that as well. Physical distancing and good hygiene are the first two, and they are absolutely the most effective mechanisms we have. But the other thing is, if you can change your clothes before you go home, or when you get home before you meet any other occupants of your house, then you get to not take home any sort of infection with you. It's a very simple process shift to further reduce any potential transition of infection. The one thing that hasn't come up so far in the discussion is around at-risk populations, and the providers of community transport cover all ages and demographics across our community, and there are parts of the community who are more at risk than others of infection. So if you are of older age, have existing disease, particularly respiratory illness, continuing to participate in a community transport activity might not be the right activity for you to support your community just at this time. That's an individual decision, but there are more risks, or there are populations of our community who are more at risk of catching viral illnesses, and in particular COVID-19. And it would be really sensible if people were able to select in to the performing roles which are not going to expose them to a potential risk or harm. So I'm just going to finish where I started. I'm going to say a huge thank you on behalf of everybody for the work that the sector has been doing. I'm in awe of what you've been able to achieve, and I am grateful that you've been committed to continuing to provide such a valuable service so that we don't have isolated people within our communities. So thank you very, very much.
That's great. Thanks, Alan. And thanks for the update. And I have to say, I think it's the reminder about the basic hygiene and risk management controls are really important. I think, and I know from a Tasmanian experience that we have to keep reminding people that because we haven't had an infection, we still got to maintain these controls. And it is a risk. I think that community, we go a little bit easy, go a little bit slack on this issue. So I think they're really, really important reminders. And obviously the Victorian experience is changing, and our providers in beautiful Victoria need to obviously be aware of that and put those COVID plans very much at the front. And also too, the thanks I think from yourself and from government is really appreciated. One thing we talk a lot about at these sessions is the need for community transport to bring itself out of the shadow. It's a big sector. Nationally we're servicing, well over 250,000 vulnerable people that are mostly frail age that just need this service to remain living independently or access to basic services. So it is a big service, and it is again the sector has done a great job in transitioning to the new COVID space. So that's wonderful. So again, thanks, Alan, and thanks to Maddie. So we have now plenty of time, Suzanne, I believe, for questions. So we have, I know there was one question that came through pre-going live, Suzanne. Is that on the questions there, or?
No, it's from Richard Garlick. I was just going to see if Richard wanted to put that through himself. Might just give him a moment. Jim's put a question there to Alan. Can you see that, Lyndon, or you want me to ask it?
I've got a couple of screens here. We've got, okay, from Jim, yeah, Alan. Given the new cases seem to be in Melbourne, do you see a regional Victoria being opened up?
So the majority of the new cases are, Jimmy, you're quite correct, are in Melbourne. There are still cases, although they're very, very sporadic, appearing in rural Victoria, regional Victoria. The likelihood is that we will open the state progressively as a whole, and then we will maintain some control or apply controls around outbreaks as they occur. So I think we will gently elevate as a whole entity and release some of the restrictions, and then apply more restrictions locally based around outbreaks. That seems to be the path that we're following just at the moment. So, but if you're in regional Victoria, then your risk is lower. There are, in case you're not aware, there are some quarantine facilities in regional Victoria, mostly associated, or all of them associated with our maritime ports. So.
Thanks, Alan. Thanks for the question, Jim. So we have Richard that's popped himself to the head of the queue there. Richard, would you like to ask a question?
Yeah, thanks. Alan, could you just, I suppose, talk to us about the use of masks? We've had different reports, and a couple of health professionals have told our drivers that they should really be wearing masks. So can you just talk about that if possible?
Certainly, a question that comes up every day for the Chief Health Officer as well. So, Richard, I'm going to try and answer it because there's multiple different tentacles to that question. It depends on what particular role of the transport provider is undertaking. So, if you are Maddie broke it up into two groups. If you're transporting people who have been screened as no risk or low risk of being COVID positive, who are not being transferred for COVID testing, who are not in quarantine, who are the normal, in inverted commas, pre-COVID customer of the Community Transport Service, then the best guidance from the Department of Health and Human Services is a document called PPE for Community Service Providers for Prevention of COVID-19. And the suggestion there is if you're not making contact with the individual, so providing non-contact care, and can maintain physical distancing of 1.5 metres, then you just need hand hygiene and no surgical mask. And if the patient has that's for patients who have no risk factors. So providing you're not going to be providing up close and personal clinical care, then mask not required for that particular subgroup. Where we start talking about patients, people who are being moved associated with a COVID diagnosis, then the best advice is that and the guidance is in the coronavirus disease guide to conventional use of PPE document, is that for patients for people who are being transported who are in quarantine, that tier 1 precautions apply, and that hand hygiene and a surgical mask is the is recommended for all of those, provided you are maintaining that you are undertaking that service in a non-contact environment. So if you have to assist the person onto a stretcher, then that is not non-contact, and you move up to requiring gowns at that point to be added to your surgical mask at that time. So as with everything, I'm sorry, Richard, context is everything. We receive regular reports of people misinterpreting the guidelines and giving providers, such as you outlined, some quite confronting feedback. And so I just want to try and acknowledge that some of the way that the messaging is being, the people's perception of the recommendations is communicated is not appropriate, but that it's done in most cases from a position of trying to keep everybody safe and well, where everybody's a little bit anxious in trying to understand what all these new terms and technologies mean. So a mask is very useful if you are unwell. It protects others around you. If you are unwell, you shouldn't be working. And so you won't be needing a mask. If you are working in the screened as negative or very low risk group providing community transport, and you've been able to assess the person you're travelling with as being well, then the risk for you is extraordinarily low. And mask and standard precautions without a mask is what is recommended. If you are working in the space where it is patients are in quarantine or known to be COVID positive or COVID suspected of being COVID positive, very different space, and that's the group that needs would absolutely be using masks as part of their standard PPE. I hope that helps.
Yes, thank you.
Yeah, thanks, Alan. I think you've gone through that in tremendous detail, and thank you for that. And good question, Richard. And I think just touching on that from a Tasmanian perspective, that absolutely mirrors the advice from the state government in Tasmania as well. One thing that has been recommended also is that if you are doing transports, someone may be assessed as no COVID risk, but in the throughout that journey, then they may present signs of COVID risk, and that's when it's handy to have those PPE and procedures within the vehicle, almost like a COVID first aid kit. So that's something also to consider. So again, thanks, Alan. Any other questions? We have to Maddie, I should say. What areas what areas do you cover of community transport?
Thanks, Rita. So we cover basically a 50 to 60 kilometre radius of Mount Waverley, which is where our vehicles are based in our community transport service. Our non-emergency patient transport is around the state, and our COVID-19 DHHS contract is also around the state as well.
Thank you. Thanks, Maddie. Thanks for reading the question. Any other questions? No. Just give people a few minutes, because typically what happens is that you consider the comments and the previous question and have an opportunity there to type something up. So we'll just give everyone a few moments. We're running well and truly ahead of schedule, which is great.
So I might just jump in, Lyndon, while people are thinking. So we just did a poll to ask about the future of the sessions. So thanks, 90% of people have responded, which is fantastic. And it is in the favour of continuing fortnightly, although that's at 56%, but it's definitely still interest for that fortnightly session. But what would be really helpful if people could say what else they would really like to hear, what topics they'd like to hear covered, any particular people or bodies, departments, organisations they'd like to hear from. I have a few people lined up, but yeah, always want to be responsive. So if you could send it through on the chat, or if they could email me, call me, anything like that, that'd be really helpful.
Thanks, Suzanne.
Yeah, there's no other questions coming through, I don't think.
Okay. We might give people another minute, and then if there's no other questions, we might have an early minute, which would be lovely. See how we go. And look, I guess too, it's not totally surprising the questions are each session have slowed down. I mean, I think in the early days of these sessions, there are lots of questions, and as we've worked through it, I think we're learning more. And I think the presenters today, or the speakers today, provided great detail and overview. So I don't think it's that surprising that we're not getting too many more questions, which is great. Thanks, Suzanne. So it looks like the fortnightly sessions are still the flavour at this stage, which is good, which is great. But just reiterating what Suzanne said, and I think having some really clear issues or questions or topics is helpful, so that Suzanne can be frantically running around lining up speakers. I think that's important. So please, if you could put that through the questions function or the chat on Zoom, or email Suzanne direct, that would be the way to deal with that one.
There's a question there from Marnie, Lyndon, that's come through the Q&A. Are you able to do that?
So, okay, Marnie, okay, great talks. Thank you both. Off topic, is anyone experiencing build-up of chemicals on cars, and how are you resolving it? So a build-up of chemicals on cars, and how are you resolving it? I can't answer that one, but not sure if anyone would like to comment on that, whether that's Maddie or Alan or anyone in the audience would like to put forward a comment. We can probably deal with that one.
I don't know about building up of chemicals on cars, but we have had some devices that have been cleaned extraordinarily thoroughly, I think is probably the best way I could frame it. Devices, most of the medical devices are not supposed to be submerged in liquid, and the very enthusiastic cleaning that has been going on has actually seen some medical devices damaged. So it is still surface cleaning that is recommended. We don't need to drown the virus, but as far as the vehicles, I'll have to defer to Maddie. I'm sorry.
Sorry, I just saw the question there from Reed. Sorry, I'm not really sure what the question is. So, what areas do the community transport cover? Not in cars, but on my office door handles. Not really.
So the question's in the Q&A, Maddie. So
okay.
That's all right. So it was about experiencing build-up of chemicals on cars and how people are resolving that.
Yeah, so I guess much like what Alan mentioned, it's just the surface cleaning that we're doing for the vehicles on the commonly used areas. So yeah, as you mentioned, not sort of drowning the vehicle. So not finding any sort of issues with that at the moment.
Yeah.
I think Michelle's advice in the chat is sensible. Just some hot water, soap and water is largely what is needed to address this virus, for general cleaning. And if you had a build-up of chemical residue where you'd been using chemical impregnated wipes, I think soap and water would be a good way of removing the chemical residue, and it's not going to impact in fact, it's probably going to allow you to clean the surfaces better if they don't have residue on them. But just because it's a chemical doesn't necessarily always mean that it's going to be better. Soap and water's worked for a very long period of time, but it will address most issues. In between known or suspected COVID patients, there are specified cleaning requirements that need to be met. But as far as general cleaning of vehicles and equipment then basic is usually still completely and utterly appropriate. Might help resolve some of that residue. Yeah.
Thanks, Alan. Well, Suzanne, just confirming there's no other questions.
No other questions. Thank you.
Okay. Well, look, I think if we're all comfortable, I think we can draw to a close. Again, I'd like to thank Alan and Maddie for coming on today and providing those presentations and updates. It's really appreciated. I'd like to thank, obviously, Suzanne again for coordinating the sessions. And all the attendees at today's session. Really appreciate you tuning in to the fortnightly sector update. So thank you all. And again, if you have future queries or questions, please send them through to Suzanne at the VICTAS Community Transport Association so that we can tailor the sessions to your needs. Again, thanks everyone. Be safe and look forward to catching up in the next 2 weeks. Thank you all.
Thank you. Bye.
Bye.